It is that time of year for all of the fall festivities like trick-or-treating, going to pumpkin patches, but it all looks a little different this year due to the coronavirus pandemic. In today's To Your Well-Being, we're going to take a look at how you can stay safe while still enjoying the fall fun. So Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snider, is joining us now. So let's first and foremost talk about it. What safety precautions should we be taking to keep safe and to prevent spreading COVID-19 while enjoying the fall festivities? Because life is not over. We want to still be able to enjoy some of the things.
That's true. Tanya, thanks so much for recognizing that. It's very, I think, important to still try to do as activities that you enjoy, but you have to still take into consideration the importance of those 3 W's. So, wearing a mask, safe distancing, and hand hygiene still can come into play with fall festivities. So I would say, especially if you're planning on going to a pumpkin patch, I would choose one that looks like they are anticipating to, decreasing crowds. I drove by a pumpkin patch recently and it looked like, they created like a line of cars and that a car would go out at one time, a carload of kids would go out at one time to pick their pumpkins and bring them back. So especially important to probably bring some hand hygiene gel with you if you're going to be touching, multiple pumpkins, to try to wash your hands between them, or definitely at least at the end. And especially if that pumpkin patch has like a corn maze, those are so much fun for kids. But you just want to be particular that, if there are going to be other families there, that there's enough safe distancing. Similar to like doing any hay rides, seeing if those numbers of people that they put on the hayride tractor is limited to either just a couple families where you can have some safe distance. Again, if you're unable to get that 6 feet apart from people you don't know, or even like your neighbors that you're not constantly, that's part of your bubble, it's important to wear a mask.
All right, so some people really like to go on the road to see like the fall leaves when they change. What kind of steps should people follow if they're riding in cars with people that maybe they don't live with, like their friends or their grandparents, and this is kind of like an outing that they do every year?
It's has such a lovely tradition, and it is important to still wear a mask within the car, especially if you're going to be carpooling with folks that don't reside with you in your household. Alternatively, is friends you go with each are in separate cars, and then you can meet in one place to enjoy the outdoors. But if you are sharing a car with folks that are not in your household, the best way to protect each other is to wear masks.
And that might feel a little weird to some people, but I mean, you are in close quarters and you're within the 6 feet that what we normally say is a safe distance.
Easily, exactly. And the fact is, right, in a car, you don't have that great air circulation. So you don't, you would never want to put your grandparents at risk, or family members that may have a compromised immune system. So it's best to wear a mask in the car, even if folks don't have any symptoms. It's particularly important to wear a mask.
Because again, we don't know. You don't
That's
know
right.
if you have it all the time. Okay, so outside obviously better than inside during the pandemic. We've all heard that. But what do you do when the temps are too cool to be outside?
Oh, I know. I think a lot of doctors and epidemiologists are a little bit worried about the upcoming winter because that's going to drive everybody indoors. I would say that if you are having a gathering and it's exceptionally cool where you can't be outdoors, then again, it's like spreading out, not having too many people in a given room, and wearing masks if you're not 6 feet apart. I think we have to try to do as much as we can outdoors. The risks of eating indoors is so much greater than it is outside. But realizing, winter is probably around the corner, that it's inevitable that people are going to be indoors.
Are there some activities that we should just avoid pretty much altogether that just pose a higher risk than others?
I think a lot of people do have that pandemic fatigue, and they're so tempted to going out to restaurants with their friends, I think the key thing is making sure you're going to a restaurant that is, decreasing the capacity of, what they can handle. Maybe going to restaurants that have good air circulation, or maybe have like outdoor patios. And then I just feel like indoor eating is pretty risky, especially because, you're sharing space with people you don't necessarily know. And we know that there has been transmission in restaurants earlier on in this pandemic.
Okay, anything else you want to say on the fall festivities and things of that nature before we get into text questions?
Sure. I think, right now the CDC is recommending not to celebrate Halloween in the traditional aspects. I still think people can make it fun for kids, still consider just, the size of the party or the kids, in a parade to be definitely spaced out. And if, you can do maybe outdoors, like some sort of a scavenger hunt. So you're trying to minimize the risks of a bunch of kids getting super close and sharing space, or like touching each other's candy and stuff like that. I think for folks who want to give out candy, making sure you can put it probably in like little plastic bags or individual wrapped containers, so that you're not digging into one bowl and touching, candy, or having you receive candy for your kids that you don't know if people have done proper hand hygiene. I think if folks want to try to do maybe like a virtual, like a Halloween costume or something like that, I think that probably would be fun as well. But it's still trying to capture the fun of Halloween, but avoid having any aspects where you're putting a lot of folks in a contained area. So, I think adult Halloween parties are probably very risky, and I would avoid those.
And all I can think of is spreading out like my Halloween candy and then just Lysoling it down, right? Because you don't know how somebody else handled whatever the packaging is. Although you go to the grocery store and you do that too, and you handle things.
Yeah, I mean, I think as long as, I think, for instance, if your kid is trick-or-treating at somebody's house, as long as they're kind of picking stuff up on their own, they're not, touching, there's not touching. I wouldn't necessarily want to put Lysol on candy that you're going to be ingesting.
Oh, I mean like on the wrappers, because like you swallow all your candy out, that kind of thing. Yes.
I just feel like also, like some of the wrappers are not really well focused. Like, when you think of bubble gum, maybe, I don't know. I don't want people to be poisoned by Lysol spray either.
And it's good that we talk about it now, because you never know what people will come up with.
Yeah, I think it's, I really feel like it could be like a coordinated effort among a neighborhood. If you kind of give guidelines and saying, this is where we're going to go trick-or-treating. You're going to line up 6 feet apart, and move like one direction. Mm-hmm. That possibly could work, but it's going to look much different than in years past, obviously. And I think if you feel like candy looks like it's being touched by too much people or stuff like that, I probably would just get rid of it and just, just get the candy that's already like in another self-contained bag.
That's right. Or buy your own. And that's okay too.
Yeah,
okay.
And that's okay, right? Or like if you do like pumpkin decorating together, you can do it outdoors, spaced apart. That's still quite a fun activity without too much risk.
All right, Dr. Snider is going to be with us until 6 o'clock answering your coronavirus questions. Maybe you've got a Halloween or fall related question or any kind of coronavirus question. You can text that question to 336-379-5775. We'll spend the rest of the half hour working to get your questions answered. We'll be right back.